So I have one story where I went to visit one of the nurses that I had done some education with a few months prior. Just wanted to check on how her patient was doing, and she told me, just wait in the waiting room 1 second, I'd like to come out to see you. So when she came out to give me a hug. It was the first time that patient had had a negative scan in years. And the patient is a young woman with metastatic breast cancer, has 4 children, and this is the first time that she's been able to see real results. So when you see that, you actually feel like you really did make an impact, and there's no better feeling in the world.
What I most enjoy about being a clinical educator is empowering other oncology nurses to feel confident in their roles. There are so many new medications and new things that are happening in oncology, so to stay on top of all of that is really hard as an oncology nurse. So if I can help in any way to make oncology nurses feel confident in their care, then I in turn have maximized patient care.
I've been a nurse for a very long time, about 28 years, and that's actually always been my favorite part of nursing, is educating patients.
When I'm out in the field, the first thing I think is, I know what it's like. I was here. I was in the clinic. I worked for the Cleveland Clinic for 13 years. 3 of those years were in clinical trials. So I know the busy clinic. I know the patients. I know what it feels to be right in the trenches.
When I first started, I was in awe sitting in that room with all of those nurses. They are smart, professional, lots of experience, kind, gentle, loving, caring, and they're now my family. My group of nurses and my leaders in this company is so exceptional. We are family, we all are smart, and they have our back, and they're just a great group to learn with, to grow with, and to work with every day.
We have really great leadership, and they're very transparent. They support us.
My leaders care about me both personally and professionally, and I have lots of opportunities not only to grow personally but also professionally. So VMS has been vital to my advancements.
Really are one of the most special networks out there. We've all had the calling to be Oncology Nurse Educators, and that's what makes us such a great network. I am Annette Caravia, and I am a VMS clinical educator.
My name is Maggie Siebeneichen. I'm a clinical nurse educator for VMS.
I'm Kimberley Munn. I am a VMS clinical nurse educator.
I'm Tracy Whitaker, and I am a VMS BioMarketing nurse educator.